Hi, I'm Vicki Libiakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air, and with us today we have plastic surgeon Dr. Usha Rajagopal, and we're talking about mommy makeovers and gynecomastia. Did I pronounce that correctly?
That's perfect.
Thank you. Later we'll be explaining what gynecomastia is, and we'll be taking your calls, answering any questions you might have about breast implants. Here's the phone number, 800-440-4884. We'll also be posting the phone numbers to the doctor's office, so be ready to jot those down. And before we get started, any advice we give you today, obviously you're going to also want to consult your own physician. Let's jump right into it. We said we were talking about breast augmentation, breast implants, but we're also going to be talking about taking away some of the breast tissue.
Yes.
For not only women, but men.
Yes, yes.
And that's kind of an unusual thing, because you don't hear too much about it. And I'm jumping ahead because first I want to find out, just give me a little bit of background on you. Tell me about your practice.
I'm a board certified plastic surgeon. I actually trained at UCSF, and I've been in practice for nearly 15 years. My office is in Union Square, a few blocks actually from here, and the office is called San Francisco Plastic Surgery and Laser Center, and we really offer a wide array of procedures for men and women, all ages, all the way from things like skincare for a teenager with acne, to laser procedures, to collagen, the Botox, all those popular terms, and all the way to invasive, surgery. So all of that is in one location.
All right, we've been hearing an awful lot lately about mommy makeovers, and I guess back in the day, before we had the kind of procedures that are being offered right now, women just kind of accepted, after you've had several kids, the body gets stretched out.
Yeah.
What kind of things can you offer people these days?
Yeah. So mommy makeover is actually a term that's designed to specifically tailored to a woman. And it's a complement of procedures that a woman may want after her pregnancy. Because a lot of times after the pregnancy, women notice that the breasts aren't as perky or as youthful as they were. Same thing with the tummy area and some areas of fat deposits. So it's really, we call it trifecta of procedures. Would be a breast augmentation with either a lift or a combination of that, a tummy tuck, or a liposuction. So those are the big three.
Now, nature plays a big hand in this, because there are some women who seem to just spring back effortlessly. They don't even necessarily go to the gym. Their abdominals just shrink back to their pregnancy state, whereas most of us, are not quite that fortunate. And is this something that even if you were to go to the gym and do how many crunches, you still can't get it back? I mean, it just physically stretches the muscle out beyond, well, yeah, spring back mode.
That's exactly right. I think some of us, just like the rest of our bodies, some of us genetically endowed to have these beautiful bodies before pregnancy. You can have 5 kids and look amazing afterwards, but then the majority of us really need a little bit of help. So say, with the breasts, when you're pregnant, beautiful, great breasts for nursing, but then afterwards you lose that fullness, it starts drooping and doesn't look as youthful, and really no amount of pec training will make those breasts lift up. And same thing with the tummy. One of the main things women notice is that they lose control of their body after pregnancy. I mean, before pregnancy, a lot of how you look depends on how much you put into it. You eat well, you work out, and then you can kind of achieve what you're looking for. But after pregnancy, especially, you've had a larger baby, you've stretched out, you've got stretch marks, your muscles have actually stretched out. So what can you do? Or twins, triplets, of course. Of course, now with so many multiples, that can be a problem. So when you have the loose skin, it doesn't matter how many crunches you do or what, you can come back to your pre-pregnancy weight, but your body is changed forever.
I have one friend, and we were all very jealous of her. Her 4th child was just at 9 months, the tiniest little bump, as they call the baby bump, and she would always spring back. But again, that is a rare thing. We've got to take a quick little break here. We're going to be talking about the gynecomastia, which we teased earlier. Okay. Fascinating topic, really. But for more information about Dr. Rajagopal, you can call her directly, 415-392-3333. Or check her out on the web at sfcosmeticsurgery.com. And we'll be taking your phone calls and continue our chat about mommy makeovers when we come back.